The MacPro Help Desk team welcomes your suggestions for our training and reference materials. Please contact us with your feedback and comments on this training, or if you need other MacPro assistance. You may contact us via email at macpro_helpdesk@cms.hhs.gov or by phone at 301-547-4688.
Hi, my name is Gigi Rainey, and I am excited to be coming and speaking with you today a little bit about the technical assistance and support for reporting the 2020 core set to CMS. Today, I'm going to be speaking a little bit about updates to the core sets and technical specifications for the child core set, the adult core set, and the health homes core set. We're also going to be speaking a little bit about data quality, providing you with a list of resources to support your states in reporting and give you an opportunity to ask us some questions. It's hard to believe it, but 10 years ago, we did not have a quality measure program for Medicaid and CHIP. And last week, we published our FFY 2019 core set data for the child and adult core set. So we want to thank all of our state partners for all of the hard work that they have done for the last decade for the child core set, as well as for the last 7 years of the adult core set reporting. So now as we enter into our second decade of child core set reporting and our 8th year of reporting the adult core set, we have slightly higher aspirations and expectations of our state partners. You guys have already done a lot of work on getting the foundation for quality reporting done, and so we are now working with you more on additional quality assurance on that data. So as you are well aware, the core sets support federal and state efforts to collect, report, and use a standard set of measures to improve the quality of care provided to children and adults in Medicaid and CHIP. And we really want to help support our state partners in using this data for quality improvement. This quality data is also used in the Medicaid and CHIP scorecard. For those who are unfamiliar with that, you can find information on medicaid.gov. We do like to support our states who are using the core set measures to drive quality improvement, and we do have selected improvement areas that have been priorities for us, which include dental care, maternal and infant health care, acute and chronic conditions, and timely and effective use of behavioral health services. And as you are well aware, through our SMI process, which we'll be going into a little bit more later, we do focus on data quality and completeness to support the use of measures by CMS, states, and stakeholders. Over time, we really have seen tremendous improvement, not only in the quality of data and completeness of data that's submitted, but also the number of states that are reporting child and adult core set measures. And for that, we are really grateful to all of you for the hard work that you're doing in collecting and reporting those measures to us. We've also seen a significant increase in the number of measures that are reported by each state over time. So the health homes core set is about the same age as our adult core set, and FY 2020 will be the 8th year of expected reporting since this core set was established in 2013. There are currently 9 quality measures and 3 utilization measures that are used for ongoing monitoring and evaluation purposes across all of the state health home programs. And in addition to the health home core set measures, each state plan amendment can report specific goals and measures identified by their individual programs. For the health home program, we wanted to provide a little bit of information on who is expected to report, because not all health home programs are expected to report for FY 2020. The reporting requirements for each state are based on the initial start date of each health home program. If you've got any questions about if your SPA is expected to report, we would like you to please refer to the health home reporting table or contact the TA mailbox. We hope by now that you've seen the various emails that have gone out that have told you that MacPro is now open for 2020 reporting for the child, the adult, and the health home core set. And we would like to make sure that you are aware that the reporting deadline for core set reporting this year is scheduled for December 31st. This slide provides you with a list of the FY19 data products that we have released so far. If you have not had an opportunity to take a look at the data products that we've put out, using all the core set data you submit, we really would encourage you to do that. We have measure-specific tables that provide detailed performance information on each of the measures that CMS publicly reports each year. Measures are publicly reported by CMS if 25 or more states report on the measure, adhere to the technical specifications, and meet the quality standards for that data. We also have a summary document for reporting on the child and adult course sets. It's a fact sheet, which is a quick, handy 3-pager that'll give you an overview of what's been going on with the course set reporting for that year, as well as the raw data being available on data.medicaid.gov. This year, we're publishing our chart packs separately from the rest of this information, and that information will be coming soon, sometime in the next 2 or 3 weeks, we expect. The health quality measures data set for the child course set is published separately from the adult course set, so you'll see links here for the child and adult measures as separate hyperlinks. So some of our goals for 2020 course set reporting. As folks may have heard, starting in 2024, the reporting of the child course set and the behavioral health measures on the adult course set will be mandatory for states to report. So as we're gearing up for 2020 reporting, we just want to remind folks of that transition that will be coming up in the next few years, and to let you know that CMS will be supporting states in their reporting of those measures through provision of technical assistance. So we'd like to encourage our states to start thinking about that now as they're reporting 2020 data, because getting into the habit and getting into the process and having those systems in place for reporting measures starting now will definitely help you to accomplish the goal of mandatory reporting in 2020 for those sets. So this year, some of our goals include to continue to increase the number of states that are reporting the core set measures and the number of measures reported by states, as well as continuing to improve the data quality to support the states in those measures. The data quality includes the accuracy of the reported data, adherence to technical specifications, the completeness of populations that are included in the data. So for example, if your state has both managed care and fee-for-service populations, including both of those populations in your reporting, it also would include reporting on both Medicaid and CHIP and dual populations, and then documentation of states' deviations and exclusions in the notes in MacPro. So if you've got any questions about that or need any support in your reporting, we really would encourage you to reach out to the TA mailbox. So on this next slide, we'd like you to take a look at SurveyMonkey, the MacPro team, and CMS. We would really like to hear from you. We have definitely heard from you about your concerns about the limitations and some of the barriers that you have experienced in reporting in MacPro, and we would like to reach out and ask those of you who would like to provide us with some feedback and information to please reach out to us. We want to do some stakeholder engagement about making some significant improvements to MacPro in future years. Please copy down this SurveyMonkey if you're interested in participating in this voluntary activity to add your name to the roster so that we can reach out to you and get information and feedback on this. If you have any questions about this, you can also reach out to our MacPro TA mailbox, but it's really fast, quick SurveyMonkey. It'll just ask for your information and they can reach out to you to allow you to engage directly with the quality measure screens so that we can improve MacPro in the future. I'm going to turn it over to our Mathematica colleagues for the next group of slides.
The MacPro Help Desk team welcomes your suggestions for our training and reference materials. Please contact us with your feedback and comments on this training, or if you need other MacPro assistance. You may contact us via email at macpro_helpdesk@cms.hhs.gov or by phone at 301-547-4688.